So what would you say if we told you there was one thing that you could do to take away the bags under your eyes and that kind of heavy lid that we all get when we start to age? Well, there is, and board-certified plastic surgeon Dr. Tamara Mosharrafa is here to tell us what that is. We welcome you to the show. Good morning.
Good morning, Stephanie.
First things first, let's talk about where we start to see the aging in kind of this area of our eyes and what happens there.
Sure. Well, the eyes really are the window to the soul, and most of our expression, most of our emotions are shown through our eyes.
Right.
We smile with our eyes. We show anger, frustration with our eyes. We show fatigue with our eyes. And unfortunately, most people show most of their age in their eyes. And so the typical signs, the things that occur that show age in the eyes are, as you mentioned, the bags under the eyes, which everybody hates, the heaviness of the upper lids, and the heaviness of the brow.
Does this occur in men and women, or is it just women who are the unlucky ones?
Well, this is one of life's little unfairnesses. The changes do occur both in men and women. But unfortunately for women, they're much more tolerated in men, just kind of like gray hair.
Right.
Men get away with things that women don't get away with. And a heavy brow in a male is not as much of an aging feature as it is a masculinizing feature. But unfortunately for women, it really is just about aging.
Yeah, it's just kind of the world we live in. Well, you know, we're going to take a quick break, but when we come back, we're going to talk about what we can do, because there's some procedures that we can have done that are going to address kind of this area and kind of brighten up our eyes. So we're going to take a quick break, and we'll be right back to talk a little bit about what we can do and show some dramatic before and after pictures. Wait till you see these. Well, I'm back with Dr. Mosharrafa, and we had left off talking about some of the effects of aging that kind of hits women and men, but unfortunately is more of an emphasis oftentimes with the women. Sure. Now, you're the bearer of good news, because there are some things that we can address through some plastic surgery that would kind of lift the eyes, take care of this. And are they separate procedures, or how does it work? Well,
they are separate procedures, and there are a number of things that can be done. There are some non-surgical things that can be done. We have things like Botox to address some of the muscle activity and soften the eyes that way. We also have things like creams to address some dark circles, and so there's some non-surgical ways to address these things. The surgical ways to address it really focus on the lids and the brow. The lids, the lower lids, the baggies, the darkness can all be addressed by adjusting the fat in the lower lids, typically through an incision inside the lower eyelid, so there's no scar there.
Inside, right here, we go in and kind of take this puffiness in the
That's exactly right. That's exactly right. And then for the upper lids, frequently it's taken out some skin. There's oftentimes some redundant skin in the upper lids. Sometimes we do take some fat out from the upper lids as well.
That we get.
Right. And but an important point that I'd like to make is that the brow really is a very important component of that. And sometimes just getting the brow in the right position, and a brow lift operation is a very effective operation in terms of rejuvenating the eyes. And sometimes when you get the brow where it belongs, the lids really aren't as much of a problem. Most women will come in and say, I need my lids done. My lids are really heavy, or they're too redundant. And when we put the brow in the right position, they realize that really the brow is the primary problem and the lids are really a secondary issue.
Well, let's take a look at a patient that you've brought along with you, a prospective patient, in fact, kind of looking into it. Donna Baker-Miller with us. Good morning to you.
Good morning.
So if she was a patient, and let's do kind of a consultation, and so we can kind of live vicariously through her, if you would.
Well, Donna is obviously a very beautiful woman and a very youthful woman, and I think she's a good example about what we're talking about. She tends to carry most of her age in her eyes. I'm not going to tell you how old she is, because I don't have her permission to do that. But most of her age, she has a very youthful neck, very youthful cheeks. The lower part of her face is all very youthful, and most of the age that she carries in her eyes. And as I was talking about before, you can see there's a little bit of sort of redundancy and puffiness in the lower eyelids. That's what gives you that tired look, like you haven't gotten enough sleep.
Right.
Also, the excess in the upper eyelids. And when I spoke with Donna before, she said that one of the things that really bothered her was the extra skin in the upper lids. But what I want to show you, if I may, is that if you take and just put the brow in a better position, and I don't know if you capture that.
It just kind of opens up the eye, just makes her just a little bit
Exactly. And you see all this redundancy that bothered her before. If the brow is just gently elevated into the position where it belongs, a lot of that excess, and now the upper lids look much better. So people come in again complaining of this excess here of the skin, But really what that problem is, it's a manifestation of the fact that the brows are too low. And when the brow is in the right position, that just goes away.
Let's talk about some specials that you have quickly.
Okay.
Just to finish up, I know that some people are kind of looking for just a little help in the way of looking
Sure.
a little bit more youthful.
Well, I mentioned Botox. Botox is a very effective treatment, and we have really everyday low pricing on Botox. We have $9.50 a unit up to 50 units and $8.50 a unit beyond 50 units. And right now there's a special going on through Allergan, the manufacturer of Botox, where they're giving a $50 rebate. So it's never been more affordable to have Botox.
Well, Dr. Mosharrafa, Donna, thank you for both being in here. We appreciate it. And here's some information on how you can get a hold of Dr. Tamer Mosharrafa, board-certified plastic surgeon. He's at 3301 North 2nd Street in Phoenix. The phone number is 602-230-1464, and you can get some more information online at experiencethebestofyou.com. And Dr. Tamer Mosharrafa is a sponsor of Sonoran Living Live. A little earlier in the show, we talked with Dr. Mosharrafa about the facial enhancements that he performs, and now we want to shift our attention to some of the other work that he does, not only on his patient Barbara, but in general. So we just want to welcome you to the show, Dr. Mosharrafa. We appreciate you spending a little bit more in-depth time.
Well, thanks for having me, Stephanie.
We're talking a little bit about a kind of a comprehensive approach to changing the way that we look. We talk about transformations. Mm-hmm. So what are some of the commonly asked for procedures and procedures that are done?
Well, first of all, cosmetic surgery can be combined safely. And in fact, cosmetic surgery can be combined with non-cosmetic procedures, and that can be done safely. We do try to limit the amount of time of surgery to minimize the operative risk from anesthesia. But typically, sometimes we kind of combine them in terms of anatomy. We'll do facial procedures together, for example. Mm-hmm. Do a facelift, brow and eyes, or do a tummy tuck and liposuction, or a breast lift and breast augmentation. Those are some of the more commonly combined procedures.
When you talk about the tummy tuck and the breast augmentation or the breast lift, mm-hmm. that just screams to me like mommy makeover, because we know that anybody that's had a child has those issues that they kind of address after they've given birth. So
yeah, and the mommy makeover is a sort of a catchy phrase that has been used to describe a combination of procedures that is meant to address some of the changes that occur with pregnancy. Mm-hmm. Typically involved in a mommy makeover is a breast lift and or augmentation, tummy tuck and liposuction, but really we individualize it to each patient to see what the changes have been and try to address those specifically.
And so what are the benefits of putting those together?
There are a number of benefits. Obviously, every operation has a recovery period, and if you combine procedures, then you combine those recovery periods into one. So there's less time off of work, less time away from your normal activities, and there also is a financial incentive to do it that way. The procedures are less expensive if they're done together than if they're separated.
That would make sense because they're all combined under the same kind of anesthesia, the same kind of...
the facility, the operating room time, all those things are combined as opposed to being separated.
That makes sense. Let's talk specifically about Barbara, because we saw the transformation in her face and how she had done permanent makeup first, and then she went to you and had some face work done.
That's right. Barbara's a perfect example of what we've been talking about in terms of the benefits of a comprehensive approach to beauty. Surgery is just one component of revitalizing or rejuvenating someone, both in terms of their face and their body, regular exercise, diet, things like that. And here you see Barbara's face. You see that the permanent makeup really makes an enormous difference. She's got a very nice surgical result, but the makeup and the teeth, she had her teeth done by Dr. Bruce Schwartz. The smile, the makeup, the surgery, all those things together really amount to a very nice change for her. I think the next picture that we have is of her tummy. Barbara had, the list of procedures that Barbara had were, she had brow lift, upper and lower lid blepharoplasty, some fillers into her, the creases in her face, and she also had a tummy tuck and liposuction. And here you see the before and afters of the transformation in her abdomen. Again, a nice pretty change. And this was complemented by her commitment to her exercise, to her dieting, and just a healthy lifestyle really adds to the quality of a result.
I always love it when doctors do kind of emphasize that it's just not going and having a procedure done, that there has to be kind of a lifestyle change if you want to maintain it.
That's right.
For the long haul.
That's very, very true, and that's the hardest part. The surgery sometimes is the easy part, but people that are really committed to changing their lifestyle, not just the way their face or their body looks, really end up having the best result in the end. I
think a lot of people might have a little bit of, I don't know, concern or just trepidation about taking that step, even though there are things that they might joke with their girlfriends, well, I'd love to have a tummy tuck, I'd love to have, you know, augmentation, consultation, I'd love to address certain issues of my body. So what would you say to those people that they talk about it, but they don't really do anything about it?
Well, I'd say just like anything else, it's worthwhile coming in and having a consultation and getting some more information, because there's a lot of questionable information out there. A lot of times the information you get from your friends or from other sources may not be true, and people are always scared of surgery. Surgery is an important decision to make in life, but I think coming in and seeing some of the reality of it will put a lot of those fears at ease.
And so there's no mandate that if you come in for a consultation, you can take that information, walk away, and think about it, and kind of incorporate it into your lifestyle.
Oh, of course, and that's what I hope everybody will do. My job during the first consultation is to be an educator and to let people know what's available, let people know what's involved with doing these things, the recovery time, the commitment that it's going to take out of them to get this transformation done, and then they go home and they decide with their family and their loved ones whether it's right for them or not.
Fantastic information. As a sidebar, you are actually offering Sonoran Living viewers a special offer today if they're interested in kind of, I don't know, a little bit more youthful look. We
are, and our offer is $100 off injectables. The injection of things like Restylane, Perlane, Juvederm has become very, very popular, and we are now offering $100 off of each syringe for any of those products when you come into the office.
Thank you so much. Pleasure talking to you.
Thank you, Stephanie. I've enjoyed it.
Well, here's how you can contact Dr. Mosharafa. His office is at 3301 North 2nd Street in Phoenix, or at the phone number that you see right there on your screen, 602-230-1464. More information online as well at experiencethebestofyou.com. And finally, Dr. Tamara Mosharafa is a sponsor of Sonoran Living Live.